This is 4 misconceptions about endometriosis. The first one is what endometriosis actually is. And a lot of people believe that endometriosis is the endometrium, so the inner layer of the uterus, growing outside of the uterus or in places it shouldn't be. We used to think that this was true, but more recent research and studies have shown that endometriosis lesions are different from the endometrium. They are very, very similar, but they are different, and endometriosis is a separate disease that is not just a problem with the uterus. It's a full body disease that we don't fully understand. Number two is very similar, is the belief that a hysterectomy, removing the uterus, is curative for endometriosis. While it is helpful for a lot of women, especially if their endo symptoms are highly related to their periods, so really heavy, extremely painful periods, periods that go on for longer than normal, yes, removing the uterus so you no longer have a period is going to be incredibly helpful, but it's not curative for endometriosis because it's not curing the actual disease process because we don't fully understand that actual disease process. Number three has to do with other treatments for endometriosis, namely being the difference between ablation surgery and excision surgery. A lot of people believe that lasering off the endometriosis lesions is a good treatment option. Think of this like weeding your garden. If we trim the tops of the dandelions, they're going to come back. That's what ablation surgery is like for endo. Yes, you might get some symptom relief for a while, but that lesion is still there. It's likely going to grow back and you're going to have more symptoms again. Whereas excision surgery is like taking the dandelion out by the roots. It's much, much more effective. Again, not curative, but it's more effective. The problem is we have an incredible lack of surgeons who are trained in excision surgery for endometriosis because it is a very specialized specialty, and it's very hard and long in a process to become an excision specialist. And number four is that endo is rare. Endo is not rare. It's incredibly hard to diagnose, and even with our low numbers of diagnosis, the most recent statistics show that 1 in 10 women have endometriosis, and it's likely even more common than that. Endo is not rare, and if you are struggling with endo or you think that you might have endo, please know that you are not alone. And pelvic floor physio can be very helpful for a lot of endo symptoms. We would love to help you on your journey.